Welcome to the deep dive. We're really glad you can join us today. Our whole aim here is to, well, cut through all the information overload. We take stacks of material, articles, research, you name it, plus our own notes and boil it down. We want to give you the absolute core nuggets of knowledge. Think of it as your shortcut to being properly informed. Hopefully with a few surprising facts, maybe a bit of humor, just enough to keep you really engaged. Today, we're diving into something truly fascinating. Our focus is Bryonia Alba, which you might know as wild hops. Now, if you're just thinking, oh, it's a plant, well, prepare to think again. The source material we've got is incredibly detailed, really insightful, and it shows Bryonia is, well, it's much more than just botany. It represents this deep understanding of a unique influence, almost like a personality, that it has on the human body and mind. We're really talking about a whole patient picture, painted not just by symptoms, but by the very nature of this remedy.
Exactly. And what's so compelling when you study these remedies is how each one seems to have this peculiar nature, almost like a person, a distinct way it acts. It's like looking at the unique signature of a disease or the defining traits of an individual. So when we dig into these remedies, it's not just about listing symptoms one by one. We look really closely at their velocity. How fast do the effects appear, their continuance, how long they stick around, and their patterns. Are they remittent, meaning they ease off and come back, or intermittent, disappearing completely for a while? So for Bryonia, the big question we're tackling today is, what's its unique fingerprint? What defines it? How does its core nature show up in a way nothing else really does?
That's exactly it. That's what we're going to unpack. Our mission here is to pull out the most profound insights from all this source material on Bryonia alba. We'll be focusing on its core characteristics, how they all weave together in the body and the mind, and what really makes it stand out. The goal is to give you, our listener, a really thorough but still engaging understanding, hopefully full of those surprising insights and practical bits that make it click. And look, if there's one key feature, maybe almost a paradox, that absolutely defines Bryonia, it's this powerful relationship it has with motion and with rest. Okay, let's start digging into that. Right, let's dive straight into Bryonia's core identity. We've kind of nicknamed it the unwavering stillness seeker. And the sources couldn't be clearer on this. Bryonia acts really profoundly on all the serous membranes, those delicate linings around your lungs, the pleura, around the heart, the pericardium, lining the abdomen, the peritoneum.
Those slick linings that allow movement. And of course, it affects the organs inside those membranes too, the viscera.
And the result of all this, it's this widespread, almost body-wide aching in every muscle.
And the type of pain Bryonia produces is typically described as stitching or tearing. Sharp pains.
But here's the absolute hallmark, the defining rule you see running through the whole remedy.
It's profoundly worse by motion, better by rest. That's the golden rule.
These stitching pains, aggravated by even the tiniest movement, they pop up everywhere. But our sources really highlight them in the chest. That's where they're often most intense.
And interestingly, in most parts of the body, these pains are also worse with pressure, which, as we'll get into, has a really crucial, fascinating twist when we talk about the abdomen later on.
So tell us more about that idea of velocity and continuance you mentioned earlier, specifically for Bryonia.
Right. It's really illuminating here. Think about remedies like aconite or belladonna. They hit you like a ton of bricks, right? Sudden explosive violence. Symptoms erupt incredibly fast. Maybe they only last for a short, intense burst.
Yeah, like a sudden high fever.
Exactly. Bryonia is completely different. Its complaints develop slowly. And when I say slow, for an acute condition, it might be over several days.
Several days, wow.
Yeah. And the symptoms are continuous, or at most remittent, meaning they might ease up a bit, but they don't fully go away. It's very rare for them to be truly intermittent, where they vanish completely and then reappear.
So it just grinds on.
Pretty much. The intensity definitely ramps up over time, but you don't get that initial blinding flash like with aconite, where a kid can go from 0 to screaming with fever in minutes. This slow, insidious onset means Bryonia fits really well with things like, say, continued fevers that gradually get worse, or rheumatisms that creep from one joint to the next until, as the sources vividly put it, all the white fibrous tissues are in a state of inflammation, pain, and distress.
That sounds miserable.
It is. This deep inflammatory quality affects fibrous tissues, serous membranes, ligaments, even the sheaths around nerves. It's a slow burn, building up to a crisis.
And that slow, almost creeping start is so typical of how a Bryonia sickness feels, isn't it? You can almost picture the patient. They've been feeling off for days, just generally unwell.
Exactly. Languid, tired, don't want anyone talking to them.
And crucially, they don't want to move. not an inch.
That's right. And this state just gradually gets worse. At first, maybe the pains just sort of flit around the body, moving here and
But
there.
little transient aches.
Yeah. But then comes the turning point. With every single movement, even tiny ones, those pains get stronger. Until they settle in, they become steady, continuous aches.
And that's when it often progresses into the really serious stuff.
Precisely. Like widespread rheumatism or a bad pneumonia or pleurisy.
It's not like a sudden thunderstorm hitting. It's more like watching storm clouds gather slowly, getting darker and heavier over days.
And making the person progressively more miserable and more unwilling to stir at all.
So that brings us to a really fundamental point you mentioned.
Yes, the pervasive aversion to motion. It's not just a symptom. It's often an early critical sign. It can show up even before the really sharp stitching pains even begin.
So they just resist moving without maybe even knowing why.
Initially, yes. They might not connect it directly, but they quickly learn through painful experience that any little inclination to move, shifting in bed, turning their head, even blinking, brings instant suffering. It makes all their aches and pains worse.
Wow.
It's this deep, almost instinctual resistance. The source material sums it up perfectly. Thus, we have the well-known Bryonia aggravation from motion. This runs all through the remedy.
It's the central thread.
It absolutely is. The golden rule, the universal signature for Bryonia's physical action. It really is the unwavering stillness seeker.
You know, to really hammer home that core idea, the sources give this striking example, almost heartbreaking, really. It underscores just how deep this characteristic runs.
What is that?
They describe how children with Bryonia complaints specifically dislike being carried, or even just gently lifted up.
Ah, yes. That's powerful.
Think about it in an infant. Their natural instinct is usually to be held, cuddled, moved for comfort. But this Bryonia child cries out the moment you try to pick them up.
That visceral rejection of any change in position, even in someone so young, it's a profound illustration of that core aversion to motion.
It's like a primal rejection of what should normally be soothing. It really sticks with you. Okay, so we've got this profound physical stillness down. Let's shift gears now and explore the mental and emotional side of Bryonia. We're calling this profile the irritable, despondent, homebound thinker.
A good description.
The sources paint a really clear picture here, maybe even a bit poignant. The Bryonia mind is exceedingly irritable.
Yes, everything puts him out of humor. That's a direct quote.
They just desperately want to be left alone. Don't talk to me. Don't ask me questions.
And definitely don't make me think.
Right, because even the mental effort, that kind of mental motion of processing things, can make their symptoms worse.
Exactly. It can increase the pain or just add to the confusion and discomfort.
And this state is quite different from other remedies, isn't it?
Oh, absolutely. It's a crucial distinction. We're looking at a remarkably sluggish state of the mind in Bryonia, which is a stark contrast to, say, the really excitable, almost frantic states you might see with coffea, where the mind just races.
Or nux vomica, maybe? Full of that nervous tension?
Precisely. For the Bryonia patient, even just the effort of talking is, and I quote, attended with horror.
Yeah.
They might look dazed, almost slow or dull, maybe even a bit like imbecilic in their demeanor.
And there's that physical look, too.
Yes, often that distinctive venous stasis look to the face. Kind of purplish, maybe puffy, suggesting sluggish circulation.
But they can talk if they have to.
Oh yes, they're perfectly capable if pushed, but they have this overwhelming aversion to it. Often they just seem to ignore everything being said.
So it's not a lack of ability, it's a lack of desire, a resistance.
Exactly. A deep resistance to any mental exertion. And this mental sluggishness, this fogginess, can actually be one of the very first subtle signs that an illness is brewing. Often starts in the morning, maybe with a dull, heavy, congestive headache. Gets worse through the day.
And that can be a forerunner to the physical stuff, like pneumonia.
Very often.
Yeah.
Pneumonia, liver inflammation. It sets the stage before the complaints even fully localize in the body.
And this leads us to one of the most classic, maybe the most quoted Bryonia symptoms.
The delirium. Wants to go home. Talks of business.
It's so specific, isn't it? And apparently very consistent.
It is. But it's vital to understand what kind of delirium it is. It's described as a low type. Meaning it bears absolutely no resemblance to the wild excitement, the violence, the vivid hallucinations you might see with belladonna or stramonium. Those are very active, agitated states.
Okay, so Bryonia delirium is different.
Very different. With Bryonia, the patient will often just lapse back into a quiet state if you leave them undisturbed. Perfectly quiet.
They only speak if bothered.
Right. And when they do, it's usually some variation of "go away," or "let me alone," or famously, "let me go home."
Even if they are home.
Often, yes. Or they might mutter about business, like their mind is stuck on everyday worries even while confused and feverish.
And this tends to happen at a specific time.
Yes, typically commences around 9 p.m., often persists through the night, usually alongside the fever.
It's interesting how that mental sluggishness can start so subtly.
It really can. The patient might just wake up feeling profoundly wrong. That dull, congestive headache we mentioned, a stupid feeling in the head.
Like a brain fog.
Exactly. A mental dullness that just stops them from engaging with work or thinking clearly. And that feeling just grows as the day goes on, often signaling something serious is developing, even if it hasn't quite settled in one spot yet.
Like that pneumonia or liver issue.
And the fact that their troubles often start first thing in the morning with that first attempt to move or think, and they just realize something is deeply not right. It points to that sort of semi-conscious daze.
And that morning worsening is another key timing element, isn't it? Helps differentiate.
It does. A very specific time modality for those mental symptoms.
Okay, now here's something that sounds like a contradiction, but the sources highlight it, and it feels really important for understanding just how bad the suffering can be.
You mean the anxiety-compelling movement?
Yes. The patient might show anxiety and whole body compelled him to do something constantly, but we've just spent ages talking about how they hate moving and are worse from it. How does that work?
It's a fantastic point, and the sources explain it beautifully. It's not a true inconsistency in the remedy's core nature. It's purely down to the sheer, overwhelming violence of the pain.
The pain is just that bad.
It's so intense, so excruciating, so unbearable that the person literally cannot keep still, even though they know, absolutely know, that moving will only make it worse.
So they're forced to move by the pain itself.
Exactly. It's a desperate, forced movement, born of agony, not any kind of search for relief. Movement intensifies the suffering, but the suffering is already so bad they can't bear the stillness either.
That is such a critical point for telling remedies apart.
Absolutely essential.
Yeah.
If you connect that to the bigger picture, you can draw a really sharp contrast with a remedy like, say, Rousseau's tox.
Right. Rousseau's tox is famous for being better from motion.
Exactly. Rousseau's patient starts off stiff, painful, maybe worse for the first movement.
Okay.
But as they keep moving, they limber up. They genuinely feel better, stronger.
Like an old car warming up.
Perfect analogy.
Yeah.
But with Bryonia, any movement, even if it's driven by that desperate anxiety, brings screeching, stabbing, intolerable pain. There's zero relief, only aggravation. It's movement forced by suffering, not movement for relief. A profound difference.
And just to round out this mental picture, Bryonia patients are also described as being, well, quite fearful and despairing.
Yes, full of fear, anxiety, despair of recovery, great despondency. That's straight from the text.
They're convinced they won't get better.
Utterly convinced. And they need quietness, both mental and bodily quietness, in the most absolute sense.
They often want the room dark, too, right? Finding light bothersome.
Yes, again, think about it. Accommodating to light involves that slight, almost imperceptible, but still painful winking motion of the eyes. So darkness feels better.
And visitors are a definite no-no.
Notoriously worse from visitors. Any disturbance, any chat, anyone just being there can feel unbearable.
The sources even give a warning, don't they?
They do. Do not cross a Bryonia patient, for it makes them worse. Their irritability is just so extreme.
Any friction, challenging their need for quiet, disagreeing, it escalates everything.
Profoundly. And this includes those bad effects from mortifications, like humiliation or wounded pride, or ailments arising from chagrin, which is that intense annoyance or vexation.
And those emotional upsets can trigger physical symptoms, like headaches.
Often violent congestive headaches, especially after an argument or controversy. That feeling of the head being just too full, ready to burst.
Okay, we've got a good handle on the mind and mood. Let's shift to the physical side now. And the big theme running through Bryonia's physical symptoms seems to be dryness, along with that intense pain and inflammation we've touched on.
Absolutely. The sources emphasize it again and again. Mucous membranes are all dry.
Which leads to that classic picture, right? Parched lips, dry mouth.
A dry tongue often feels like it's sticking to the roof of the mouth, dryness in the throat. It's pervasive.
And this deep dryness causes that intense thirst.
Yes, excessive thirst. But here's the specific Bryonia twist. It's not for little sips, frequently.
No.
Now, the Bryonia patient craves and needs large draughts of water, big gulps. but taken at long intervals.
Why long intervals?
It seems their internal system is just so sluggish. They might down a huge glass of water and then feel okay for hours before needing another one. It's about quenching that deep internal dryness.
And this dryness isn't just the mouth and throat, is it? It's body-wide.
It really extends throughout. Let's take the head symptoms, for example, since they often show up early. Bryonia is famous for its bursting, splitting headache. Like the head is going to explode outwards.
As if hit by a hammer from within. That's a vivid description from the sources.
It really is. And this headache is severely aggravated by any motion.
We mentioned even blinking.
Even blinking. Or the subtle movement of the eyeballs feels like a knife twisting. Talking, any mental effort, it all makes it worse.
Which explains why they want to press on their head.
Exactly. That desperate need to hold the head tightly with their hands or tie a bandage around it, that firm, steady pressure across the whole skull actually gives some relief to that bursting feeling.
And these headaches can be a sign of worse things coming.
Often, yes. A forerunner of deeper issues like lung congestion or inflammation elsewhere. They commonly start when waking up, maybe a stabbing pain over the eyes or deep in the back of the head, and just get worse as the day goes on.
Okay, moving down to the digestive system. What about the stomach and abdomen?
More specific but equally characteristic bryonia signs there. Patients often feel nausea and faintness specifically when rising up.
There's that motion aggravation again.
Always there. They might have a strange ravenous hunger or completely the opposite total loss of taste, where everything's just bland, maybe even unpleasant.
And the stomach area itself.
The epigastrium, that spot just above the stomach, is incredibly tender to touch. And there's often that very distinct feeling of a stone in the stomach after eating. Just heavy, sitting there, undigested.
And vomiting can happen.
Yes, often vomiting bile and water right after eating. And here's another interesting nuance. They're distinctly worse from warm drinks.
Even though they crave cold water.
Yes. Warm drinks are often vomited straight back up. It's like the stomach just can't tolerate warmth, despite the general thirst for cold.
What about lower down, in the abdomen, the pains there?
Well, the liver region is often affected.
Yeah.
Swollen, really sore, tense, with burning and those characteristic stitching pains.
And how does pressure affect these pains?
Critically, these abdominal pains, especially liver and peritoneal inflammation, are worse from pressure. Also worse from coughing, and worse from breathing deeply.
That's the opposite of the headache pressure relief.
Exactly. This is that crucial distinction we mentioned. The aggravation is so bad that the patient often lies with their knees drawn up.
Why is that?
It helps relax the abdominal muscles, takes the tension off that inflamed peritoneum lining.
Makes sense.
And they also consciously shorten their breathing. Take really short, rapid, shallow breaths.
To avoid the pain of a deep breath.
Precisely. You might see them just occasionally take a big sigh with great effort, even though they want to breathe deeply, simply because it hurts too much. That restricted breathing is a huge sign of the internal inflammation.
And the bowels. Dryness seems like it would cause issues there.
It certainly does. Bryonia often presents with constipation. The stools are described as hard, dry, as if burnt.
As if burnt. That's specific.
Yes, very dry, maybe crumbling. And they often seem too large to pass easily. Just a real lack of moisture.
But it can also cause diarrhea. That seems contradictory.
It does, but it's a very characteristic diarrhea. Often it's one that drives the patient out of bed in the morning.
Motion again. The first movement of getting up triggers it.
Exactly. It's described as a gushing, copious, bilious stool, or sometimes a yellow, mushy discharge. And sometimes it can even happen involuntarily during sleep, which points to a deeper state of relaxation or weakness.
But the key is that morning motion aggravation.
That's the defining feature for the Bryonia diarrhea.
Okay, let's talk respiratory system. This seems like a major area for Bryonia.
It absolutely is. Often leads to serious conditions. You get soreness in the larynx and trachea, this raw, scraped feeling, which leads to that typical dry, hacking cough. Comes from irritation high up in the trachea, a tickle that just doesn't clear anything.
And it's often worse at night.
Frequently worse at night, yes. Often bad enough that the patient must sit up in bed, just struggling for breath.
And the cough itself sounds violent.
It is. So racking it feels as if the chest would fly to pieces. That's a direct quote.
Wow. So they have to hold themselves.
Exactly. They literally have to support their chest with their hands or press their head down onto their sternum just to brace against the agony of each cough.
And if they do cough something up, what's the sputum like?
Highly characteristic. Often rusty-colored or brig-shaded. Yeah. It's tough, tenacious, and sometimes described as falling like lumps of jelly because it's so thick.
And breathing is difficult?
Very difficult and rapid, again, mostly because of those intense stitching pains in the chest. Every movement of the rib cage is agony.
Classic picture for pneumonia or pleurisy, then.
Absolutely. Pleuropneumonia, Krupus conditions, where there's that deep inflammation of the lungs or their linings.
It's also really important to mention Bryonia's preference for the right side, isn't it?
Yes, that's a very common observation, especially in things like right-sided pneumonia or liver inflammation.
So you'll often see the patient lying on the right side.
Yes, or maybe on their back, because lying on the affected side helps to limit its movement, which offers a slight bit of relief, or at least less aggravation.
Because they just dread any motion. Finding stillness is everything.
It's paramount for them.
Okay, so let's recap the general pains. We've got aching in every muscle, that profound weariness.
Right, and rheumatic pains, swellings, joints get red, swollen, hot, with those stitching, tearing pains.
All worse on the least movement.
Without exception. And furthermore, every spot is painful on pressure. Even a light touch makes them wince.
Okay, but this brings us back to that crucial distinction, that puzzle.
The pressure modality.
Right. Most pains are worse from pressure, you said. But the source material also says the pain in the stomach and abdomen is better from pressure. That seems like a direct contradiction.
It does seem like one initially, and it's a point that often confuses students. How can one remedy have opposite reactions to pressure in different areas?
So how do the sources explain it? How do we reconcile that?
It's about understanding the generals versus the particulars. The sources clarify that while many Bryonia pains are indeed worse from pressure,
like that headache being relieved by tying it tight, or a painful joint feeling better with firm pressure.
Exactly. Those pains fit the better from pressure modality. But the abdominal and stomach pains, especially when it's the peritoneum or the liver that's inflamed, those specific pains are distinctly aggravated by pressure.
Okay. So it's not all pains worse from pressure and not all pains better. It depends where the pain is.
Precisely. And that distinction is absolutely vital for the practitioner choosing the remedy. It tells you about the specific nature of the inflammation in that area.
It's a key differentiating symptom, and it really shows you need to look at the details, not just paint with a broad brush.
Absolutely. The particulars always matter.
Okay, let's move on to what are called modalities and triggers. Basically, the environmental factors, the circumstances that really influence Bryonia symptoms.
The things that make it better or worse.
And as we've hammered home, the number one influence is motion, the primary aggravator.
Overwhelmingly so.
It's not just a general idea, it applies to so many everyday things. The sources give such clear examples.
Like even the winking motion of the eyes, causing pain.
Talking makes things worse. Thinking makes head pains worse.
Getting up from bed, even just rolling over in bed is agony.
Walking upstairs feels impossible.
Any and every movement just ramps up the suffering. It's that deep resistance to any change in position.
Now, what about temperature? How does heat or cold affect Bryonia?
This is fascinating too. Bryonia is quite consistent here, but again with those really important exceptions you need to watch for. Generally speaking, many of its complaints, especially the headaches, the mental fog, the overall nervous excitement, are clearly worse from a warm room.
Worse from too much clothing, worse from the warmth of the bed.
Yes, all of those. Patients often say they want the windows open. They crave fresh, cool air.
They suffer in stuffy places.
More than most people, yes. Like a crowded church, or the opera if it's warm and close. A bit like a podium in that respect.
So cool air feels good. Calming.
It brings profound relief. Calms the anxiety, the confusion, makes them feel less congested, less stifled. They'll literally kick the covers off, even if they have a fever.
There are exceptions, right? This is where it gets nuanced.
Exactly. And this is why careful observation is everything for the practitioner. The sources point out some key exceptions. Remember how the patient craves and drinks lots of cold water?
Yes.
Well, paradoxically, their stomach complaints are often relieved by warm drinks.
That is counterintuitive, isn't it?
It really is. And also, in some rheumatic complaints, especially in the limbs, the pains can actually be better from heat.
Better from heat. And maybe even continued motion. That sounds like the opposite of everything else.
It does, but it seems to be a very specific kind of continued motion in that context, not the general motion aggravation. It just highlights how complex these remedies can be. You can't just rely on one single rule, you have to see the whole pattern.
So how does a practitioner make sense of these apparent contradictions?
It really comes down to discerning the general state of the patient. That pervasive dryness, the overall hatred of motion, the irritability, versus these very particular ameliorations that only apply to specific, localized symptom.
Oh, the exceptions don't negate the overall picture.
Exactly. Our sources stress that in all its opposite states, there is still a grand nature running all through, sufficient to detect it. Meaning, even with these little quirks, the core Bryonia signature, the dryness, the motion aggravation, the irritability, the slow onset, it's usually consistent enough to identify the remedy.
You have to look at the whole interconnected image, not get thrown off by one detail that seems out of place.
Precisely. The big theme of stillness and aversion to motion is still paramount.
What about eating and drinking? How does that affect things?
Highly characteristic impact here too. The sources state, quite broadly, the patient himself, in all complaints, feels worse after eating.
In all complaints, that's sweeping.
It seems to be a very strong general tendency, whether it's the cough, the headache, even gout, generally worse after eating. The cough, especially, is noted to be worse after eating or drinking, can trigger really violent spells.
And drinking cold water when hot, that's a specific trigger too.
Yes, a very specific one. It significantly aggravates rheumatic symptoms, the cough, and especially the headache.
How does it worsen the headache?
It can apparently increase it tenfold, turning it into this violent, throbbing, bursting pain, almost like the sudden cold causes too rapid a contraction of blood vessels or something.
And time of day. Are there specific times Bryonia symptoms flare up?
Yes, clear time modalities, which are incredibly helpful for differentiation. That mental state, the dullness, the confusion that often gets worse upon rising in the morning.
Okay.
But as the fever state really takes hold, the symptoms often take on a distinct 9 p.m. aggravation.
9 at night.
Yes. This applies pretty consistently to the chills, the fever itself, and the mental symptoms like that low delirium. They tend to ramp up around 9 p.m. and worsen through the night.
Which contrasts with?
With chamomilla, for example, also extremely irritable, but their big aggravation is often around 9 a.m., usually with those awful colicky pains.
Ah, so those timings are really crucial clues.
Incredibly powerful diagnostic clues.
Are there any other specific external triggers mentioned?
Yes, a few that shed light on that deeper emotional sensitivity. The sources mention bad effects from mortifications.
Mortifications, you mean like deep humiliation, wounded pride?
Exactly. And also ailments arising from chagrin, which means intense vexation or annoyance.
And these emotional upsets trigger physical things?
Yes, they can lead to those headaches, especially after an argument or controversy.
Is that similar to any other remedy?
It brings staphysagria to mind, which also has ailments from chagrin. But the reaction is different. Bryonia's reaction is often quieter, more morose, internalizing the upset. Staphysagria is often more for outwardly violent or excitable people or those who deeply suppress their rage.
Okay, different flavor of reaction.
Right. And then there are those environmental triggers we touched on, suffering in church, at the opera, in close warm rooms, much like lycopodium.
Because of that aversion to warmth and stuffiness, preferring cool, open air.
Exactly. All right, let's dig a bit deeper now into the constitutional profile. What kind of person, what kind of underlying disposition is Bryonia often suited for? We're moving beyond just the acute symptoms to the more ingrained nuances.
Okay, the typical Bryonia type.
The sources describe a common Bryonia constitution as having robust, firm fiber and dark complexion, often with a tendency to leanness and irritability.
So strong, maybe a bit rigid, lean and irritable.
That's the picture painted. But it's also noted as being remarkably well-suited to plethoric subjects.
Plethoric, meaning
Full-blooded, robust individuals, often described as being venous in their makeup.
suggesting that sluggish circulation, venous congestion tendency we talked about,
Exactly. And because of that, they're often prone to catarrhal congestions.
which is inflammation and fluid in mucous membranes.
Right, like persistent colds that seem to settle deep in the chest, chronic sinus issues, bronchitis, that kind of tendency.
And then there are these really specific, quite odd, peculiar symptoms that make Bryonia stand out even more.
Yes, some very intriguing ones. For instance, the sources note frequent bleeding of the nose when menses should appear.
Nose bleeds instead of a period.
Or as a vicarious discharge, meaning it substitutes for the period if it's suppressed for some reason. A fascinating kind of compensatory mechanism.
That is fascinating. What else?
There's the curious constant motion of the left arm and leg, just this persistent, restless movement. It's a symptom also shared with Helleborus, actually, another remedy linked to dull senses.
Okay.
And maybe one of the most striking, clinically seen ones, the constant motion of the mouth as if the patient were chewing.
Chewing. Even without food.
Yes, especially noted in children who have brain affections. Even tiny babies without teeth might do it. It's a very peculiar, almost involuntary movement. And reinforcing that dryness theme again. Lips parched, dry, cracked. So dry they can even bleed in really severe states like typhoid when the whole body's just desiccated.
This brings us to another famous keynote symptom, one you hear quoted a lot but maybe needs careful handling.
Ah, yes. He wants something and he knows not what. Or the variation, desire for things that cannot be had which are refused or not wanted when offered.
The patient asks for something, you give it to them, and they push it away.
Exactly. Now, while that's a very important bryonia symptom, and often a strong clue, the source material is very clear on a fundamental principle here.
Which is?
It only calls for bryonia if the rest of the symptoms fit, if they all line up to form that coherent bryonia picture.
So you can't prescribe just on that one symptom alone?
Absolutely not. It illustrates that bedrock rule of homeopathy. Individual symptoms always have to be seen in the context of the whole patient.
Are there other remedies with similar behavior?
Oh, yes. You need to distinguish it. For example, creosote children might ask for a toy, then throw it back, but often it's more out of pure capriciousness. Or chamomilla, intensely irritable, never satisfied, rejects everything offered, often angrily.
So how is the Bryonia version different?
In bryonia, this behavior often seems to stem more from a profound confusion, a general dissatisfaction because they feel so awful, and that dulling of their senses. It's less about petulance or anger and more that their mind is just too sluggish to know what they want, or they lose the desire the moment it's actually in front of them.
And the loss of taste you mentioned earlier, that fits with this dulling of senses too.
Perfectly. It's deeply connected to that general slowing down of his sensations. Patients describe their taste as flat, insipid, pasty. Everything just tastes wrong or like nothing.
It's linked to that state where his whole state is benumbed.
Exactly. As if their intelligence is so clouded they don't even know where they are. The source says the tongue itself is no longer intelligent.
Meaning it misinterprets tastes.
Yes, maybe something sour tastes bitter or just nothing at all. And the tongue itself often looks characteristic.
How so?
It can be thickly coated white, almost like a layer of white fur. Or, in those really severe states like typhoid, it gets dry, brown, cracked, might even bleed. You might also see swords on the teeth, that dark, crusty buildup on the teeth and lips you see in severe fevers with dehydration.
And this dullness affects other senses too.
Yes, often smell and hearing are dulled as well, making the patient seem really unresponsive to what's going on around them.
So how does all this tie into the practical application? The sources mention an ironclad rule.
Yes, the ironclad rule of homeopathy. The remedy must be similar to the patient. Not just matching a few symptoms, but ideally resonating with their whole constitutional nature, their underlying sensitivities.
And this extends to practical advice, like diet.
It does. It highlights this profound connection between a person's constitution and how they react to external things. For example, a bryonia patient with that tendency to dryness and maybe digestive issues is often made sick by eating certain things. The sources mention sauerkraut, vegetable salads, chicken salads specifically.
So it's not general dietary advice for everyone.
Not at all. It's about individual sensitivities that are considered inimical, meaning harmful or adverse, specifically to the bryonia state or the action of the remedy. Eating those things could disrupt the healing process.
Interesting. Any other examples?
Well, the sources mention how a patient doing well on roost tox might have all their symptoms come right back after taking a bath.
A bath. Why?
Because the bath, perhaps the temperature or the prolonged stillness, might counteract the roost tox modality of being better from heat and motion. It stops the remedy's action.
So it's about ensuring the patient's lifestyle choices actually support the remedy's action, rather than fighting against it.
Exactly. It really underscores that deeply personalized approach, matching the remedy and the surrounding conditions to the individual.
Okay, let's try and pull all these threads together now, connect the dots, and really solidify this complete bryonia picture. It's clear from everything we've discussed that bryonia has a really broad range of application, doesn't it?
It does, largely because its action on those serous membranes is so widespread and its symptom pattern is so distinct.
So we see it used in things like diseases of a typhoid nature, those long fevers with dullness.
Yes, prolonged fevers, prostration, that sluggish state. Also various types of pneumonia and pleurisy, obviously, with that chest inflammation.
Inflammation of the liver, glands, bowels, like gastroenteritis, peritonitis.
And joint inflammations, too, whether they're rheumatic or even related to injury.
The sources mentioned it can be useful after injuries where arnica doesn't help.
Yes. Sometimes arnica, which is great for the immediate shock and bruising of an injury, might not be enough if a deeper, more Bryonia-like inflammatory process sets in afterwards, especially in joints. Bryonia might be needed then.
So connecting this all really underlines how important it is to see the whole picture, the full image of the remedy, doesn't it?
It's absolutely crucial, seeing the complete nature of the remedy, not just grabbing onto one or two symptoms. That holistic view is what truly lets us differentiate Bryonia from other remedies that might seem similar on the surface, but operate in fundamentally different ways.
Like the comparisons you made earlier, let's revisit those quickly. Aconite versus Bryonia.
Right. Aconite, sudden, violent, explosive onset, often left-sided, maybe bright red blood and a sputum fresh hemorrhage. Bryonia, slow, insidious onset, often right-sided preference, rusty-colored sputum, older, deeper inflammation, worlds apart in their timing and quality.
Okay, and belladonna versus Bryonia. Both can have high fever, delirium.
True, but belladonna is all about intense suddenness, active, almost manic excitement, flashing eyes, vivid hallucinations, a hypodynamic state. Bryonia, as we've said, is slow, sluggish, passive, leads to that profound stupefaction, dullness, a low, muttering delirium. The violence is internal, not expressed outwardly.
And the comparison with roost tox, that seems like a really key one.
Perhaps one of the most critical and one that often trips people up. Because yes, the Bryonia patient might be forced to move by extreme pain and anxiety.
But they hate it and feel worse.
Exactly. Whereas the roost tox patient is genuinely better from continued motion. Movement brings relief, strength, eases the stiffness.
So for Bryonia, movement aggravates despite the compulsion. For roost tox, movement ameliorates despite the initial stiffness.
You got it. A fundamental difference in their core relationship with motion.
What about Temomilla versus Bryonia? Both very irritable.
They are, but the timing and quality differ. Chamomilla's peak aggravation is often 9 a.m., with that unbearable peevishness, often intense colic. Bryonia's fever and delirium characteristically worsen around 9 p.m., and the irritability is more morose, wants to be left alone type. Those time modalities are key.
And ailments from chagrin or arguments. You mentioned staphysagria.
Yes, both can be indicated after emotional upset. But staphysagria is often for more excitable, perhaps outwardly volatile people, or those who deeply suppress fierce indignation. Bryonia's reaction, while affected, tends to be quieter, more morose. The headache or general worsening comes from internalizing the upset, rather than that suppressed rage dynamic.
And the diarrhea, you compared it to petroleum.
Right. Both can have that morning diarrhea driving them out of bed. But the key difference is petroleum patients characteristically don't have stool at night, no matter what. Bryonia's diarrhea is often triggered by that first morning motion and can even happen involuntarily during sleep.
Okay. And lastly, liver involvement. You mentioned chelidonium.
Yes. While Bryonia certainly affects the liver, chelidonium has a very specific keynote pain, going from the front straight through to the right shoulder blade. That specific location isn't typical for Bryonia's liver pain.
So what really shines through here and what the source material drives home so powerfully is that symptoms aren't just random dots. They form this coherent, interconnected pattern, a whole patient image that defines the remedy.
Exactly.
And here's where it gets really interesting, right? It becomes less about just memorizing lists.
And more about understanding. Understanding the specific details, the subtle distinctions between remedies, the why behind how they show up.
That's what gives you real insight into how these remedies work and how to use them effectively.
It's like learning to read the whole story the patient's body is telling, not just picking out individual words. Learning to see that intricate tapestry. Hashtag tag outro.
So, after all that, what does this deep dive into Bryonia alba mean for you, our listener? We've journeyed pretty deep, haven't we? From that profound, almost desperate aversion to motion and the absolute need for stillness, to the characteristic dryness, that unique, low, morose irritability, and those very specific physical signs.
It really is a remarkable and distinct picture that emerges.
It really illustrates the depth of understanding that's possible when you study these remedies closely.
And hopefully this deep dive has shown you that knowledge isn't just about memorizing facts. It's most valuable when it's truly understood, when you grasp how concepts connect, when you can see that complex patient picture.
That image or nature of the remedy.
That's what truly matters. It allows for a much deeper understanding of why it acts the way it does, why it manifests in such specific ways. It's like learning to recognize the body's own language when it's crying out for stillness, dealing with dryness, or expressing that quiet suffering.
And as we wrap up today, here's a final thought for you to maybe chew on, something a bit provocative perhaps. Given Bryonia's profound aggravation for motion, its almost desperate need for stillness and quiet, how might we think about that principle beyond just physical symptoms?
Interesting question.
How might it resonate with modern life, where constant motion, whether it's digital, endless scrolling, constant notifications, or physical, just always being on the go, hyperconnected, where that's become the absolute norm?
Is there maybe a hidden Bryonia aspect in all of us sometimes? Longing for just a bit more stillness, a bit more quiet in a world that relentlessly pushes us to keep moving, keep doing, keep reacting.
Something to think about. Well, thank you so much for joining us on another deep dive. We really hope you leave feeling not just informed, but genuinely curious, maybe inspired to explore a bit more. Until next time.